Hello and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Melissa Hritzik. We have a lot of health and wellness news for you in this episode, including, are your children ready for the new school year? We'll hear from a Tavares pediatrician who shares important tips. Patients with Parkinson's disease are benefiting from specialized therapy that helps slow progression of the condition. And a Lake County hospital is first to offer patients a specially trained nurse to help them navigate through their cancer journey. First, a Umatilla man is alive today thanks to the quick actions of the emergency team at a local hospital. Specialists who treated Chris Reed credit the team's extensive training and the fact that he was visiting his father, who was a patient at Florida Hospital Waterman.
I was taking care of my dad, and I went to wash my hands at the sink, and then I started to sweat profusely, and I got dizzy and started seeing a jagged rainbow in my peripheral vision, and then my heart started fluttering. Well, 25 seconds later, it was not getting any better or worse. It was just bad.
Reed says he headed to the nurse's station where a nurse recognized something was wrong.
Off to the ER we went in rapid succession with many people in tow. We got to the ER, they hooked up an EKG. Leone, the cardiologist, said he saw something that didn't look right, so they got a ultrasound going. And then they didn't like what they were seeing.
The patient never had any previous heart history. I talked to him, I saw the EKG, and I agree with him. It does look very suspicious for a heart attack. But when talking to the patient and I listened to the patient, there's some sound you can hear from the heart that make you suspect something else is going on. We did the echo, and that confirmed my diagnosis that this patient has what called aortic dissection.
Aortic dissection is a very uncommon but really lethal cardiac disease. And what happens in those patients is the layers of the aorta start to separate. And think of it as an unzippering, if you will, of the layers. And what happened in his case, and which is what made it especially threatening, is the dissection started to head into the heart as opposed to away from the heart. And in the heart, in the area of the dissection, is where the aortic valve is housed. When the dissection occurs, it starts to unzip at the level of the valve. And now, in addition to having this life-threatening problem with the aorta, feeding blood to the heart and the rest of the body, now you have a valve that becomes incompetent or doesn't work. And you can hear that. It's very loud.
I was sitting on the gurney. Dr. Gary Allen stepped around the corner and smiled at me. I said, "You're gonna crack my chest, aren't you, Gary?" He goes, "Yes, I am." He said, "We got a lot of stuff going on here."
The procedure to repair Mr. Reed's aorta took approximately 8.5 hours.
So in order to get him well, we had to remove his damaged valve. He had had some damage of the coronary arteries because of the dissection. And then we had to replace what we call the ascending aorta, which is the part that comes right out of the heart and goes all the way up into what we call the arch vessels, which are the arteries that feed the brain and so forth. This is about as big a surgery as we get in cardiac surgery. There is no minimally invasive way to do it.
I think I was walking around by noon. So I felt good. Everybody said, "You look good." Everybody in the whole hospital came to see me. And then they put up on a board my AKA miracle. One of the nurses walked in with a pad. He said, "Okay, give me the lottery numbers, because you definitely got some luck on your side."
I have been in practice for 18 years. I've done over 5,000 heart surgeries, and this is far and away the fastest I have ever seen anybody go from symptoms to diagnosis, to therapy, and I think it's part of the reason that he did so well.
You can learn more about local cardiac care in Lake County by visiting fhwatermanheart.com. Next, a local hospital is the first in Lake County to provide cancer patients a specially trained advocate to help navigate their cancer journey. Florida Hospital Waterman is offering a cancer care navigator to guide patients through their entire treatment and recovery process.
There are two of us, and we're both oncology nurse navigator certified generalists. We are trying very hard to see patients from diagnosis, or in some cases, pre-diagnosis when they have an abnormality, and to be able to travel with them to surgery, to chemotherapy, to radiation, and also a very important component is survivorship.
Janice Ambrose of Mount Dora says the cancer care navigators were helpful during her treatment for lung cancer.
The care navigators are helping to be the patient advocates. They really help you go through the different places that you need to be in and what's out there to help you. I've been called a hand holder, I've been called many different things, but we're a point of contact for the patient and their family during their journey. We're there to educate the patient and by educating them, empower them.
The Cancer Care Navigators are a free service to all Florida Hospital Waterman cancer patients, and physicians will soon be able to make referrals.
Actually, they'll be able to put it in the system. When the patient's in the hospital, they'll be able to go ahead and just like they would order a test, order me. We want Florida Hospital Waterman to be a one-stop shop for patients. It's hard enough to have cancer, but to travel around to get different services is just so stressful. We want everything to be there for the patients and their families.
Find out more about the Cancer Care Navigator program by visiting fhwatermancancer.com. In other news, local patients facing a Parkinson's disease diagnosis can slow the progression of their symptoms. A local neurologist says that his patients are benefiting from specialized physical therapy for the neurodegenerative disorder.
It is a condition, again, affects primarily elderly patients, but younger patients can also be affected by Parkinson's disease. Typically, patients have slowness, stiffness, shaking, and loss of balance. Yeah, the good thing about Parkinson's disease is it is a disease well researched and well understood by the neurologists and the scientists. And we have very effective treatment which can help patients have a good, productive life for up to a decade. Physical therapy and exercise is very, very important in addition to medications, because it seems like the physical therapy and exercise seem to re-educate our brain and body about our mobility so that we can stay mobile, stay stable without falling in Parkinson's disease.
Dr. Sam, as he likes to be called, says he'll often refer his patients to Florida Hospital Waterman's Rehabilitation Institute for physical therapy.
With LSVT Big, what we do is we teach patients how to move in a bigger movements, like increase amplitude with their movements, because part of it is that their movements become smaller and slower, and when that happens, then all of this difficulty in walking, balance problems sets in. So there is 7 specific exercise that is included in our treatment. That is what we call maximal daily exercise, which it already incorporates balance, coordination, strengthening, range of motion exercise. And then part of the treatment also is teaching patient how to walk properly, minimizing the shuffling gait, very small movement, and also the freezing motion when they walk. They have to continue with that exercises. So it's like a lifelong commitment. If they continue with the treatment, the progression of this disease slows down.
Visit the website on your screen to learn more about extensive therapy services available at the Rehabilitation Institute. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. A young mother explains how a minimally invasive procedure helped her overcome monthly pain. How ready is your child for the new school year? A Tavares pediatrician has tips for success in the classroom. And how can families who are always on the go be sure to have a healthy meal? Stay tuned for a recipe when we visit the Conry Creation Health Center kitchen. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this month's episode. You might want to check out these upcoming community events. Don't go away. Waterman Wellness will be right back.
It's time for the Creation Health Tip of the Month. Activity means using all of your muscles. Increase your activity by adding weights to your workouts this week.
Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Melissa Hritzik. We turn to women's health in our next story with information about a procedure that may help alleviate monthly discomfort.
1 in 5 women would experience heavy bleeding. Starts probably around age 30s to 40, really peaking in the 40s, and probably is the most common cause of a visit to a gynecologist. And the most common cause, the underlying cause, is hormonal imbalances.
Josie Goodman of Mount Dora sought relief from Dr. Perot because her monthly episodes were affecting her quality of life.
I had brought my labs from my primary doctor, and she had noticed that my hemoglobin was low, and I had told Dr. Perot that I had heavy, painful periods that could last anywhere from 10 to 14 days. Not only was it painful, heavy periods, but I was also tired, having difficulty keeping up with my children.
Dr. Perot recommended that Goodman undergo an endometrial ablation.
The endometrium is the inner layer of the uterus, and it is what thickens just before your periods. As a matter of fact, the work of hormones, the work of estrogen, is to thicken that lining. And as that lining becomes thicker and thicker, progesterone slouches that off. Well, in patients with hormonal imbalances, there's almost always low progesterone. And therefore, the lining of the endometrium becomes thicker and thicker, and therefore your bleeding becomes heavier and longer and even with pain. So the endometrial ablation thins that layer out and thins it out permanently.
That night I went home. My friend dropped my kids off from school. I ordered pizza, and we were back in our routine. It changed how I get to go out with my children and how much energy I have, and it improved my quality of health and how I feel, and I'm really glad I did it for myself.
It's minimally invasive. I call it a win-win situation between the physician and the patient, because the patient is able to come in, have it done, can be done in an outpatient setting, and get to go home and continue her normal activities and go back to work at a relatively short period of time.
Like any procedure, the endometrial ablation is not for everyone. Visit the website on your screen to find a local expert for a consultation. Next, we turn our focus to children and making sure they're ready for the start of the school year. We asked a local pediatrician for important advice for families.
The biggest thing to understand, it is a transition. We've gone from several months of unstructured activities during the day to an expectation of having a very structured day in school. Preparation is the key. So several weeks before that first day of school, start talking about your child, about their new school or new teacher. Some schools have programs where they can go and visit the classroom, so kids can prepare mentally and emotionally about what it would be like going back to school.
Dr. Diaz says another potential impact on student success is sleep.
So often sleeping patterns during the summer become a little bit more chaotic, maybe a little bit less structured, maybe me going to bed later at night, sleeping in during the morning, and then all of a sudden we have to get up earlier in the morning to go to school. So starting again several weeks before, start going to bed just like you would during a school night, so you can help prepare your body for that new pattern. Kids definitely need at least 8 to 10 hours of sleep for most children. Younger kids need more. And that's extremely important for them to be able to be alert and learn and function appropriately during the school day. If your child tends to be more anxious about transition, you may need to work a little bit more closely with them, also helping kids prepare for what it's going to be like.
Visit the website on your screen to find a pediatrician to help you and your children be healthy for school. A healthy meal to start the day is key to a student's success in school. Next, we visit the Con Recreation Health Center kitchen, where Caroline Rowland learns an easy recipe that busy families will enjoy.
It's about time to send the kids back to school, and getting out the door in the morning, always a challenge. Getting breakfast on the table, we know, can be impossible sometimes, but skipping breakfast, never a good option for your children. So today we have some easy recipes you can make in the morning. Right now we're joined with Florida Hospital Waterman Executive Chef Fred Sugar and registered dietitian Mara Gallo. Mara, tell me a little bit about what we're going to make.
Today we're going to make a simple smoothie recipe. It's easy, it's quick, your children can take it with you on the go. It has oatmeal, strawberries, lots of good seasonal fruit.
Great, so Chef Fred, tell me a little bit about what is in here.
Awesome. Today we have fresh strawberries, low-fat plain yogurt, cinnamon, oatmeal, ice cubes and water to make the consistency of the smoothie and give it good body and texture. And we'll be using a half a banana to further enhance that. So what we'll do is we'll start with 1/2 a banana. We'll take the lid off of the blender.
And if you don't like bananas or strawberries, can you substitute these?
Sure, you can substitute using either fresh fruit such as blueberries, mangoes. You could also use a frozen fruit, a frozen blueberry if fruits are out of season. So those are also very good options. So right now we'll take the strawberries and the bananas, we'll put those into the blender.
So Mara, there's a lot of good ingredients in this recipe that'll keep the kids full throughout the morning, right?
Definitely. We have some oatmeal, which is very high in fiber. We also have yogurt, which is high in protein. And then you combine the carbohydrate of the fruit, it makes a nice hearty breakfast.
And you were telling me a little bit about cinnamon. We have cinnamon in this recipe, not just tasty.
No, cinnamon is very good for your children's attention, and it can speed up their motor visual responses.
And what's neat about this recipe is it's just so quick and so easy. And the smoothie pops up, and we have a wonderful, nice bodied smoothie that we'll pour into the glass.
Looks delicious. Mara?
Thanks, Chef Fred.
Cheers.
You'll find the recipe for the strawberry, banana, and oat smoothie by visiting watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Alyssa Hritzik for the award-winning Waterman Wellness.